Hi, my name is Dr. Antonio Webb. I'm an orthopedic spine surgeon here in San Antonio, Texas. Here's what to expect the day of your clinic visit with me. There's this big misconception that when patients come to the spine surgeon's office, that it means that you'll need surgery. And that's not necessarily true. Over 90% of the patients that come to my clinic are treated with some form of conservative treatment, whether this is physical therapy, chiropractic therapy, certain medications, activity modifications, epidural or lumbar injections to essentially treat your pain. The day of your visit, it's important to know that you should arrive early. This is to complete paperwork that is required and also to verify your insurance. Once you're checked in, you'll be escorted back to the exam room. And this is where the medical assistant will ask you some general questions regarding your medical history, verifying your medications that you take, as well as a little bit of information regarding the nature and why you're at the visit. You will then be escorted to our radiology suite to obtain x-rays. And these x-rays provide structural information about your spine, and whether this is in the cervical spine or the lumbar spine, we're looking for certain fractures or dislocations of the bones. We're looking for degenerative findings such as arthritis in your back or your neck, bone spurs, anything from a structural standpoint that we can use to help diagnose your pain. When a patient comes to the clinic and to my office, there are about 10 different things that can cause back or neck pain. And it is my job to, number one, to listen to you, to figure out what's going on, and also to determine the best course of treatment for you. During this process, and after imaging studies are obtained, I will come into the exam room and we will chat. We'll ask about your history. How long has it been hurting? Where does it hurt at? What treatments have you tried and what has not worked for you? We will then do a physical exam. And this is where I will touch certain parts of your body, such as the back of your neck. I will have you move your neck or your low back. I will make sure that the muscles themselves are working, make sure you have sensation as well as reflexes. In addition to undergoing some provocative exams, which means I have you rotate or move your body in certain positions to see if we can elicit that pain. We will then go to the computer screen where we will thoroughly go through your imaging studies. And my goal as a surgeon when you leave my office is for you to understand exactly what's going on through your history, your physical exam, and then the imaging studies to determine what the best course of treatment will be. After we review your imaging studies, we will then discuss some available treatment options. And as I mentioned, over 90% of patients can be treated with conservative treatment. So it's usually some form of physical therapy, some medications, some injections, some conservative options outside of surgery. Surgery is always the last resort, and I really stand by that. Once we determine kind of what your diagnosis is and what our best course of treatment is, then we'll come up with a plan to see you back in office. And most patients will try some conservative options for 4 to 6 weeks. And if those options are not alleviating your pain, then we discuss the next course of action, which is usually some injection or surgical intervention. Well, I hope this video explains what it's going to look like the day of your clinic visit with me. And as I mentioned, most patients don't need surgery. And I'm Dr. Antonio Webb, and I look forward to meeting you at the office.